Brenda Cherotich, and it's a pleasure to see you right now.
My name is Brian Urinda. Thank you, and it's a pleasure to meet you.
My name is Francisca Akini, nurse at Kenyatta.
I can't hear you at the back there.
My name is Francisca Akini, a nurse at Kenyatta National Hospital, and I've been taking care of Brian and Brenda. Pleasure to meet you, sir.
My name is Ruth Nancy Kera from Kenyatta National Hospital, IDU, nurse manager. We are happy that Brenda and Brian are now well to go home. Thank you.
My name is Dr. Kamuri. I'm the CEO of Kenyatta National Hospital, Your Excellency. We are happy to discuss with you this morning. Thank you very much.
My name is Dr. Elsa Chiang. I'm the doctor heading the infectious disease unit at KMH. It's very good to see you this morning.
Well done.
Yeah. Morning, sir. My name is Susan Mochache, the PS.
Thank you, sir.
Thank you, Waziri, and especially to our two friends, Brenda, Brian, and indeed to all our health workers, our doctors. Just to say what a great pleasure it is to be talking with you this morning, and to really say that for me this is a very special moment. It's a special moment because, as many of you know, a few weeks back on a Sunday, we were on the stairs of Harambee House, where we informed Kenyans that we had as a country, our first case of coronavirus, and as a result, that information is when, as a country, we began putting in place measures to help us tackle this particular virus. Why is this such an important day? It is important because, as much as we are all aware of the pandemic and its spread across the country, we were not until that particular moment aware of the fact that it had arrived already on our shores. Brenda, we have been referring to you in the past as patient one, because it was necessary for us to keep confidential your details. But why are you a special woman, and especially a special young Kenyan? You are special because immediately upon your arrival, immediately upon you feeling that you were not well and realizing what was going on in the world, without being coerced, without being forced, without being pushed by your parents, you took it upon yourself, realizing that you potentially had the risk of harming other Kenyans, to take yourself to Kenyatta Hospital and to tell them that you were not well. I believe that this is a moment of pride. We are very proud of you, Brenda, because through that, we were able to conduct the tests, we were able to confirm, you were able to inform us in a very calm manner all the people that you had been in contact with. We were able to do backward tracing, and that's how we got a hold of Brian and many others. So indeed, we are celebrating today, despite the challenges that we continue to face, your bravery. but more importantly, your patriotism in recognizing that you had a responsibility not just to yourself, but to your country, to your neighbors, to your family, to your friends. As a result of that, you were able to limit your contacts with other people. You were able to identify the people who inadvertently you had been in contact with, who were able to trace. And there is not one single death that can be attributed from your infection. You're a very brave and wonderful girl, Brenda, and we celebrate you for that, and we are grateful to you. This in light of others who, unlike you, were not willing to report, were not willing to tell us of their conditions, and who have proceeded to infect numerous other people in the process, people who should have been, who are older than you, who are leaders, who should have known better. And this is what we are telling all our Kenyans. Let us follow Brenda's example. If we were able to follow Brenda and Brian's example, we can contain this disease. As the two young people before us today are showing us, we can not only contain this disease, but we can treat it, and we can get out of it. So for all of us who are out there, who have these kind of symptoms, let's behave like these brave and patriotic young Kenyans. Let us report our symptoms. Let us stay away and avoid infecting and affecting other Kenyans. Let us bring ourselves forward. Let us isolate ourselves, and let us be treated, because it is treatable. It is treatable. There is no stigma in telling Kenyans that I have a problem, especially when there is a problem that is treatable and you have not brought it upon yourself. Come forward. Tell us. Isolate yourself like these two wonderful kids have done. You today, having recovered, are our pride and joy. Brenda and Brian, I want you to tell the world, I want you to tell your fellow Kenyans that be honest, be straightforward, isolate, don't infect, help your brothers and sisters. I also, in the same breath, want to thank all the medical staff represented by those in the room for the work that you are doing and have been doing. Your work is truly appreciated. You risk your lives to save others. Do not think that your work goes unappreciated. We appreciate truly your work. And we hope that through your hands, many more Kenyans will live to celebrate as Brenda and Brian are celebrating today. We thank you for your work. We also want to thank all those in different agencies across the country who are working almost 24/7 to ensure that our country and our people are safe. Our security forces, our people in transport, the multi-agency team that is meeting almost on a 24-hour basis, representing all the agencies of our republic who are sitting at the command center in Embakasi. We thank you for your efforts. We appreciate your efforts. Let us continue to pull together. Let us continue to work together, because together we can and we shall defeat this virus. I know, especially when we introduced the curfew, maybe in the initial stages there were some challenges, and I want to apologize to all Kenyans, maybe for some excesses that were conducted or happened. But I want to assure you that if we work together, if we all understand that this problem needs all of us, and we all pull in the same direction, we will overcome. I want to thank those in Mombasa who are now orderly crossing the ferry. I want to thank all those who are ensuring that they maintain their work schedules while allowing our Kenyans to leave work on time in order for them to make the curfew. Undoubtedly, we as a government are preparing for the worst, but together with 47 million Kenyans are hoping and praying that we do not need to take further measures. Once again, I just want to appeal to you, my brothers and sisters. This is not a problem that knows tribe, that knows age, that knows race, that knows region that you come from. This is our problem together. And so long as we face it together, we shall overcome. To you wonderful, wonderful kids, I want to praise and say how proud I am of your bravery, your courage, your sense of patriotism, and your love for those around you, and your desire to ensure that you moved away from those that you love in order to protect them and brought yourself forward. Let us as Kenyans follow the example of these two wonderful, wonderful Kenyans. And I think on that note, I would like first you, Brenda. You're no longer number one, now we can call you Brenda. And my friend Brian, please tell Kenyans of your experience. Brenda.
Yes. Okay, so to everyone listening to this, I first went to the US on December 19th. So I landed in Texas, and then when I finished my stay there, I took a flight from Cleveland in Ohio. Then I went to Chicago, and I had a 10-hour layover there where I had some interactions with certain people, and then from there I took a flight to London. So from London is when I think I may have contracted the virus in London, or on the plane back to Nairobi. So after landing in the country, I had off 3 days into landing in the country. So when I suspected they might have been something, as a responsible Kenyan citizen and a patriotic Kenyan, I decided to watch the response of my body for 1 day, and then the next day, that is when I presented myself to the hospital, because I saw on when I was in the US, I had seen something about Mbagathi Hospital having an isolation center. That's why I went to Mbagathi. So I think that was very useful, the information I saw, because at least it helped me know where to start. So Mbagathi, I would like to thank the staff that I met there, because they took me seriously and they gave me the mask. Immediately I mentioned that I had gone abroad and I was having a cough, and then they took it seriously. So I went into quarantine for the past 23 days. I have been quarantined and I've been receiving proper treatment, and I would like to be very thankful to Kenyatta National Hospital and the nurses. It was not an easy thing to do, I know, because the nurses were also, I think they were also, you know, under some pressure because it's the first patient seen this before, but they were really nice. They were very supportive, the doctors as well, and the cleaners who came to clean my room. They used to talk to me a lot because sometimes I was very emotional, but I would like to assure everyone, all the Kenyans, that this is something that can be managed. It's treatable. Sometimes you may show very, very mild symptoms, just a cough and a headache, but when you see that, you're supposed, you know, as a responsible Kenyan citizen, you should contact the authorities and tell them, I'm not feeling well, this is how I'm feeling, and be, you know, come forward and be confident, because they're going to treat you and they're going to do everything for you. So that's all I have to say. Thank you very much.
Thank you.
Yeah.
Thank you, Brenda. Thank you, Brenda. Brian.
Yes, for me, I got the virus from contact with Brenda over here. So she imported it, and then I think I got it from the community transmission, what the ministry is calling that. So immediately, Brenda's results came back. I'd like to thank the government, your government, because they reacted very fast. They came for me wherever I was. They took me to a government facility, and I was tested, and immediately the results came back as positive. The government, your government again, embarked on treating me for the past 2 weeks or so. And as a result of that treatment, I've recovered. I'm feeling much, much better now, like I was before. So, yeah, that's all I have to say, really. What I'd like to tell other Kenyans, okay, I was speaking to an aunt of mine from up country yesterday, and she was telling me the fact that her nephew, me, had the coronavirus. At least she can believe that it's something real and that it's in Kenya, because so many people up country especially do not believe that corona is real. But I want to tell them that it's something that in necessary precautions, and just follow what the government is telling them at all times. Yes, thank you.
Thank you very much, Brian. Thank you very much, Brian. We appreciate that, as we appreciate you, Brenda. And let me just, in conclusion, just say we are all very proud of both of you. We are thankful to God that you have managed to go through treatment and you are now well, able to go about your businesses again and continue with your lives. But once again, to appeal to all Kenyans, we can overcome. Let us not be scared to say if we are not well. Let us isolate ourselves. When we talk about social distancing, it's not a joke. It's not a joke, especially for those who know they are not feeling well. Let us keep away and avoid spreading this deadly disease. And those of us who have it, those of us who are feeling unwell, let us follow the example of these two wonderful Kenyans who have shown us that you can come forward, you can isolate yourself, and ultimately you can be treated and recover from this deadly virus. Fellow Kenyans, the government has taken measures. We may, as circumstances unfold, be forced to take even more measures. But let us all understand that these measures are all aimed at protecting life and keeping Kenyans safe. Let us work together. Let us abide by the guidelines and protocols set out by the Ministry of Health. And let us continue working together until we overcome this challenge. Brenda and Brian, thank you. Waziri, make sure over the next few days, as you release them, bring them over to me. I want to meet them myself in person, not over a camera. I want to assure Kenyans that this is a disease, yes, that if treated can be overcome. I'm looking forward to seeing you guys soon.
We're looking forward.
God bless you all.
Thank you, thank you, sir.
Asanteni sana.
Asante.